right, we're going to go ahead and get started. I'm Carrie Brown. I'm the project director for Healthier Jupiter. Thank you so much for being here tonight. We've got a lot of great speakers tonight and a lot of great information to share with you. So first, thank you guys so much for making it out on the Thursday night. So I know you guys have a lot of important things to do and families to attend to, so we definitely appreciate you coming out. Even John Corus, who his birthday was yesterday, and he has a special night tonight too. So should we sing happy birthday to him just for? Oh, all right, next time. So thank you again for being here. I'm going to go ahead and bring up Abby Goodwin from Palm Healthcare Foundation. Palm Healthcare Foundation is the funder for Healthier Jupiter, so we're definitely appreciative. So make sure to give her a big round of applause.
Thanks, Carrie. Thanks, everyone. Again, my name's Abby Goodwin. I'm the Vice President for Grants and Community Investments at Palm Healthcare Foundation. We are a 15-year-old foundation here in Palm Beach County whose mission is to solve critical health care issues with the community. Since its inception, we have worked in partnership with organizations, systems, and communities to improve things like diabetes, behavioral health, family caregiving, and near and dear to our heart is nursing advancement. About 2 years ago, we made a very strategic shift in our funding, and that was really at the heart of this funding was a recognition that communities really have the expertise in how to solve the most pressing healthcare issues. So with that acknowledgement, the Healthier Together initiative was born. And Healthier Together is a 5-year commitment that Palm Healthcare Foundation is making here in Jupiter and 5 other communities around the county to solve these critical health issues. Here in Jupiter is diabetes. And I have to say it's probably almost a year and a half of formal engagement with the foundation. It has been so incredibly exciting for our Board of Trustees and Palm Healthcare Foundation staff to watch the evolution that's taking place here in Jupiter. It is community-driven, community-defined, and community-implemented. These projects and programmatic steps and strategic vision that Carrie and the steering committee have really developed and are implementing now. So congratulations to everyone, especially to Carrie Brown, the fearless leader. And I also have the pleasure to introduce John Corus, who, as the CEO of Jupiter Medical Center, has shown a level of commitment to this project that is a model, not just here in Palm Beach County or in the Healthier Together initiative, but truly for community-led, community-driven health-related issues nationally, truly. So, John?
Good evening, everybody. How are you? Before I begin, I'd like to introduce, and you're going to hear from him in a moment, our new mayor, Todd Wodrowska. Todd, thank you for being here very much. It's great to have the support of the town and the leadership. I was asked to spend a few minutes with you and talk to you about what Healthier Jupiter means to the medical center. I mean, we're very involved because we're the fiscal agent for the project. But here's sort of, if you think about health and wellness for this community. First of all, Jupiter Medical Center has one shared purpose. We really, in our world, we talk about one thing and one thing only, and that's to care for the health and wellness of the community. We purposely don't talk about taking care of people that are sick, even though that's obviously in part what we do. But our responsibility really is to care for the health and wellness of the community. It's to keep people healthy and well and productive. Why? Because people that are healthy and well and productive create great environments, they create great communities, they create great economies, and people get attracted to communities that are focused on the health and wellness of everybody in the community. So when we were approached to take a look at this new model, a very proactive model, I might add. We said we were delighted and we were honored because it really fits with what we do. And as a not-for-profit medical center, we treat everybody, regardless of their ability to pay. Anybody that walks through our doors or comes through one of our physician offices or outpatient centers, we treat, we take care of. So to be able to partner at a grassroots level with a group of individuals focused on proactively teaching people how to make better choices, how to eat correctly, the importance of exercise, and really become part of a community that's focused on taking care of people and keeping people healthy and well was an absolute no-brainer for us. And we're delighted. I mean, Carrie is our fearless leader. Where is she? She's back over there. Absolutely outstanding. And I know that it might feel like, like mutual love fest here. No, you're great. No, you're greater and all of that. No, you're better. But the reality is this comes with a tremendous amount of work from the steering committee to our administrator to the town. And I'll leave you with this thought. And I remember I've been here a little over 6 years. My family, my kids went to school in town. My daughter starts high school at Jupiter High School next year. And I was thinking about, probably about 4 or 5 years ago, I was sitting with the town and we were talking about actually, my clinic, which is the free clinic in town that we support and collaborate with. And one of the folks from the town said, our motto in Jupiter is uniquely Jupiter. I think that is incredible because the program we're talking about tonight is unique. It's different. It's innovative. It fits in with how the town views the world as it relates to innovation and creativity and engaging the community in meaningful and in thoughtful and in genuine ways. And so to be part of that and to see the results that you're going to see in a few minutes is a really big deal for us. And we're honored and delighted to be a part of this entire journey. So thank you very much. And now I'll ask the mayor to come on up and say a few words.
Hey, good evening, everybody. I'll start by saying that make no mistake that the town of Jupiter, the medical center that we have here in Jupiter Medical Center is in fine hands, and you got a rising star in John Corris who's taken the Jupiter Medical Center to places that most of us never thought was possible. So, if you don't know, I've only been the mayor since March. But I did grow up in the town of Jupiter. It's my hometown. It's a place that I love dearly. And I'm so proud to be standing up here tonight as your mayor to talk about something that's so wonderful about this healthy initiative. And when Carrie called me and we started talking about what to talk about tonight, I got my wheels turning about what exactly can a town, what can a municipality do to help support an initiative. And I thought, there's a ton of places around town of Jupiter and Tequesta in North County here. There's Gold's gyms and there's CrossFit places popping up all over the place and Hard Exercise Works. I work out at one of the place right behind Home Depot. It's called BGI Fitness. And there's plenty of places where you could kind of go pay a trainer. But I think what really captures an initiative like Healthier Jupiter are places where people can just go and be outside and be active. And I said, I haven't really thought about it in those terms. But so today, I just did a little inventory. And I said I was going to start from east and move west. So when you think about Jupiter, we are so fortunate to be, our eastern boundary is the Atlantic Ocean. So anybody could just drive up to the ocean first thing in the morning and go for a swim. Or you could walk along the beach for 3 miles, dog-friendly beaches if you wanted to bring your dog. You could then move a little bit up and right on the pathway there on A1A and Beach Road, and you could just kind of watch people rollerblade or bike or go along the most spectacular stretch of road that you could ever see. But if that's not your thing, that's okay. You could actually just move down a little bit west of Carlin Park and go on the Hart Trail. The town of Jupiter, we got this phenomenal Hart Trail where it's about 1.5 miles around. It's a little over a mile, not quite 1.5 miles, I think. And if you wanted to go and get a good piece of exercise, you could go around there and do each station. And that's been there for well over 20 years. A phenomenal thing, a Hart Trail. And as you move to the west, Jupiter, without much money being spent, has become an ecotourism capital of the world when it comes to paddleboarding, stand-up paddleboarding, kayaking. If anybody's been fortunate enough to go visit Fullerton Island, which is a new, unique area, the Jupiter Outdoor Center and Blue Line paddleboards right in conjunction with Guanabanas, we have these amazing abilities to just launch a paddleboard or a kayak and go for just the most beautiful little trip you could ever see. And I haven't even gotten to US 1 yet. You get to US 1, and the town of Jupiter has embarked over the past 15 years on a project called the Riverwalk. And the Riverwalk is about 3 miles that starts down by the Jupiter Ocean Racquet Club and is going to go all the way north to the inlet, stopping right there by Jetties and the Love Street project. Of 3 miles of a Riverwalk where the public has access to walk along the Intercoastal Waterway and just go for a beautiful walk and enjoy all of that area. As you start heading west in the town, okay, you could sign up for a pretty nominal fee and go for a swim at the North County Aquatic Center. If you're on the slower side, you can hang out with the manatees, and if you're on the faster, a little bit more competitive, you move over to the left, and that's where the wahoos go swimming. Those are the names of the folks that go in the swimming lanes. And these are you can be as competitive as you want, or you could just go for a leisurely swim. And then we start going, I haven't even mentioned Jonathan Dickinson State Park. Jonathan Dickinson State Park boasts an 8-mile trail of single-lane biking that you could go on. Or, I mean, it's a gigantic state park with an amazing amount of trails, wildlife, and nature. We've got Maplewood Park right there at the corner of Maplewood and Tony Penna. Jupiter Village Park, just a quarter mile to the west of that, for just enjoying outdoor space and go for a run or go just enjoy an outdoor park. We have Abacoa that's just come online with the skate park and now Abacoa Community Park. All of these tremendous facilities. And then Jupiter Community Park, right there by the interstate and I-95. We've just instituted, in cooperation with Palm Beach County, a beautiful walking trail. So if you wanted to go and drop your kid or your grandchildren off at Jupiter Community Park while they have a practice, you could go for a beautiful meandering walk. And I haven't even reached I-95 or the Turnpike yet. So once you get to past there, Riverbend Park and the old Jupiter Trail and all these amazing trails and fitness trails, they're all out there in this beautiful section of the world that we call the North County, and Jupiter is the central focus of it. So this was just me jotting things down. I probably missed a couple of things. But really it's imperative on organizations and initiatives like Healthy Jupiter to make sure that we tout all of these things, and virtually every single one of these things that I just listed, it doesn't cost anything except the cost of getting there. It's very inexpensive, and it's about getting outside, getting your heart rate up, moving around, and doing things that initiate and talk about a healthy life. So these are the things that actually John touched on that make us uniquely Jupiter. And I left my favorite one for last. If you ever want to just absolutely capture the most wonderful aspect of Jupiter, pick a nice blue sky day, walk over, and walk up the Jupiter Lighthouse. It's about 110 steps. It's not a heavy lift, and you walk up to the top, and you get up there, and it's just the most breathtaking view that you could ever have. And you get outside and you get to enjoy this wonderful thing, and you do your little part for Healthier Jupiter. So that's my favorite one and all. And if you do that, I'd encourage you to drop a couple of bucks in the kitty for the Lighthouse Society that's in charge of keeping looking after that. So with that, those are just some of my comments and some of my ideas that we're very proud of at the town. On behalf of the town, I thank Carrie and all these folks for putting on this nice event. It's really a great turnout for a middle of the summer. It's tough to get folks to come out on these types of things. And it's really wonderful to see all you folks out here tonight. And thank you for inviting me and for allowing me to be a part of it. Thank you. Appreciate it.
This is Gene Hudon. He's one of our Healthier Jupiter co-chairs of our steering committee, and I'm doing the clicker for him because I'm that much of a control freak.
No, I can't walk and talk at the same time, so. Todd and John, thank you so much for being here tonight. We really appreciate your input and your attendance here and taking the time out of your busy schedules. Can everybody see this clearly in the back, or do we need to dim the lights? We good? Okay. Creating Healthier Jupiter. Palm Healthcare is our active funder in our community and recognized Jupiter for our collaboration on health issues. Jupiter was selected the second of 6 communities to receive $1 million commitment over a 5-year period from Palm Healthcare Foundation. It addresses one of the 3 areas of health that Abby had mentioned earlier, and our focus is on diabetes. From the start, we used the collective impact model to make decisions. Simply put, it means we invited the entire community to participate in the decisions and the directions of this initiative. And we'll continue to do that. We feel very important that we need your input to our program. Of the 3 areas of focus, again, we chose diabetes prevention. It seemed to be really the best fit for Jupiter. Our founding partners, we have a strong founding partners group here. The foundational partners were instrumental to build a strong and healthier Jupiter. Having these foundational partners, they were already accustomed to the collaboration. As the commercial says, it's so priceless to us to have them on board. My Clinic, which is a 2-year-old venture, provides the free health care in Jupiter for those in the vulnerable areas of our community. Jupiter Medical Center, you heard John speak, they are the bedrock of wellness and healthcare in Jupiter, and also our fiscal agent. El Sol, as I think many of you are familiar with, is a 10-year-old resource center which sparked the initial collaboration. And the town of Jupiter, the mayor, the council, and the staff who find solutions to the tough problems have been invaluable to us. The Edna Runna Center, and I think Edna's here this evening, who's on our steering committee, and the school district are already working for all our community's children, and especially those at risk. The Diabetes Coalition, the Florida Department of Health provides specific resources to those at risk in diabetes. Our vision to create Jupiter community working together, supporting each person to live the healthiest lifestyle possible. Healthier Jupiter is a community initiative addressing health and quality of life issues, starting with diabetes. We're taking 4 steps: increase the awareness of diabetes and healthy lifestyles, helping people make healthy food choices, become more active, and get necessary medical care. When we were first deciding on our focus area, we looked at the results of the Jupiter Medical Center Community Survey and found that diabetes, along with cardiovascular disease, stroke, and certain types of cancer, were among the top health issues in our population. Focusing on the preventive actions towards diabetes and healthy lifestyles would support diabetes prevention and management and would also help address these other health issues. Why diabetes? I just want you to focus on those 2 lines under why diabetes. It's a very impactful statement. For the first time in over 200 years, children have a shorter life expectancy than their parents. It just took me aback when we found that out. We're victims of our own society, of our own affluence, and our children will pay the price unless we do something to create a healthier lifestyle and healthier culture. In particular, type 2 diabetes is related to the obesity epidemic, and that's affecting our country. And there's no reason to believe that we're any different in Jupiter than the rest of the area. Our community survey, which we've taken, confirms this. While the news is sobering, the risk of developing type 2 diabetes and prediabetes can be reduced, not cured, but reduced by following a healthy and mostly plant-based diet and increasing healthy activities. I think at this point, I'm going to turn the program over to Carrie, and she's going to take you and move forward.
Thank you, Dean.
Thank you, Carrie.
So just to talk a little bit about our goals and strategies too. So the great thing about this is it is a collective impact approach. So we're really taking it from the community first, and then instead of kind of top down, we're going community and then up. So the thing about that is, even when we were working on our strategic plan, I think everyone here has worked on a strategic plan at some point. So normally you go, you sit in a room, you write it out, it takes you a couple hours, and you kind of go off that every year. So a strategic plan for Healthier Jupiter took 3 months. It took going to a lot of community meetings, getting a lot of feedback, and then finally reaching out to a community meeting just like this to see if we were headed in the right direction, even though we had had that feedback for that solid 3 months. So that's kind of the goal that we've went to, and I'm really happy to see so many of you guys here involved because we really need your feedback. So we have the funds behind us, but we're looking to you guys to see the direction that you want to go. So that's why it's important for you to be here, be part of our committees, and be part of the initiative as well. So really those goals and strategies that work well for us too, I'll let you read it, but a lot of important things too are that we really depend on those partners that we work with. So El Sol, Edna Runner Tutorial Center, Jupiter Medical Center. So, you know, as we've heard, and why people give me the accolades is because there's only one employee, so really people can only thank me and say good things about me or say bad things about one person. So it's really not about one person, it's about our partners and our steering committee. So really all of the decisions that are made by our steering committee, our subcommittees, and our community. And with that, so even just education. So we go to a lot of health fairs, but we try to do that with our partners as well. So having Siobhan from Jupiter Medical Center, who's the diabetes educator, having her there as well. So if someone does take our diabetes risk assessment and they score high, we have those tools to say, this is Siobhan, or this is Diane from my clinic, the free clinic, to really utilize those resources that we have. So I'm not clinical, so I'd really hate to tell someone what they should be doing to get on the right track, but I will if I have to. I mean, I've heard Siobhan enough. But we really utilize those partners. So with that too, some of these things are items, so those goals and strategies are things that we've already worked on. Like that community survey, we've completed that task, and that was quite a mountain itself too. So great things came out of that to really set us with a baseline. So we have a 5-year commitment from Palm Healthcare Foundation, and with that we really wanted to set a baseline so we could have some measurement throughout this initiative. Some other things that we're working on too are an Eating Smart Partner program. So that's a restaurant decal program. We're not trying to be the food police, but we do just want to let people know, even when they're going out for a burger, there are other healthy options that are available. So even if you're going to a burger joint, there's probably something healthy there too. So we just want to give people a subtle reminder of things that they can do to just change small things in their diet. And with that, Penny Levy from the Department of Health, what she does with that restaurant decal program that's just about to get started, she'll analyze that recipe. So at least one recipe from a restaurant's menu would meet those American Heart Association guidelines. And there's some other requirements that restaurants have to do too, but that's mainly one thing that we want to do. So it's still, again, not about being the food police, because but we know at these restaurants there's at least one thing that you can do to have a healthy option. So we want to help Jupiter become more bikeable and walkable. One thing that we'll be doing too, and we'll talk about it in a little bit, is we have a national speaker that's coming in October, and I talked with Todd about it as well, just to share with the community. So we're bringing him in, and he's an expert on walkability and exercise, and he's going to do a walk audit of around here. And one of the tools that they use as well are, low-cost options, no-cost options, and then down-the-road options. So there's really an opportunity that we can bring someone to the community that has some great ideas. So we're utilizing these Healthier Jupiter funds to really build the infrastructure in Jupiter as well, along with the great work that the town of Jupiter is already doing. I don't know if any of you spend much time on the Town of Jupiter website, but I seem to spend a lot of time there. But there's a lot of great things that the town is already doing and has already been working on for years too. So we're not reinventing the wheel. Some of those projects that they've been working on for a really long time. So great job. We're giving you all the credit of it. You're the mayor now, so So with that too, more diabetes prevention programs. So with that, Jupiter Medical Center has a great program going on. My clinic has some excellent tools too. YMCA, I think Robin from the YMCA is here. So YMCA has some great initiatives too that we'd love to bring up this way as well as diabetes prevention. So just really utilizing those tools and letting people in other parts of the community and the county know too that there is an issue in Jupiter and to come on up here. It may look like that we're an affluent community, but we also have a need to bring people up here to get in those pockets that really need some additional assistance. And then, so another thing that we're working on too with my clinic is a getting started toolkit. So we talked to, when we first were getting started, we did a lot of focus groups, and one was with Dr. Gary Pepper. And one great thing that he said that really resonated was, you know, a lot of times someone would come into the office and they would really need to get started. So, you know, they need to get started exercise. Maybe they're on the verge of that prediabetes, or maybe they're just, you know, they're right there, but they really need to start exercising. He'd love to have a one-pager that he could give to them that was kind of the best of the best. So instead of sending someone home to go through you know, all the websites that you would have to go to. So that's what we're working on in our access to medical care. We're working on what we're calling a getting started toolkit. I named it, so I mean, I'm not sure if anyone agrees with that, so we may need to work on that. But with it, it's really the best of the best. And then utilizing those resources that are already, that Todd already talked about, that are free resources in Jupiter too. So we've got a lot of great things happening. So just by the numbers, I just want to point out a few things that are really interesting on this one too. So 376 residents took the survey. So with that, it is a good pocket of, we really utilized our partners for this as well. So really to get that solid baseline. So we have a community fiscal agent, which is Jupiter Medical Center, and just for anyone who doesn't know, so we are funded by Palm Healthcare Foundation, and those funds are funneled through Jupiter Medical Center. So they're the fiscal agent, but it is through that through that Palm Healthcare Foundation grant. I'm lucky enough to be housed at Jupiter Medical Center, and they, you know, they house me, give me all the resources that I need, so I'm lucky to have that, but they're considered our fiscal agent, which the funds are funneled through. So we had, one thing I want to point out is we have 326 Facebook followers. And I would love for you guys to leave this meeting, or even if you want to pull your phone out during the meeting, I'm totally going to think that you're doing it to just like our page. But I'd love to have you like the Healthier Jupiter page and then invite your friends to like it that you think would be a resource. It really is a great tool for us to get out there, things that we need, like, you know, people to come to our subcommittee meetings, people to tell us about restaurants. We share a lot of information about healthy events that are happening in Jupiter. So I'd love you guys to use it as a resource and a tool. And if you have events that are coming up, I'm happy to share those on our social media too. But I'd love to get that number up just out of this room. I think we could bump it up with you guys liking it and sharing it with your friends. We could probably get to 500 by the end of this week. So I'm counting on it. One thing too, so 2,000 pounds of fresh produce were grown in El Sol's community garden. I don't know if you've been to El Sol's Community Garden, but it's an incredible resource. And it was one of the first grants that Healthier Jupiter provided too. So we did a garden coordinator. So it's really exciting to see what's happening. And then that 2,000 pounds, you know, a lot of times people aren't even weighing their stuff. So that's just what they could get people to weigh. So just if you have not had a chance to go there, they will be having on July 8th, and we'll show it in just a little bit, a tour of their community garden. So you definitely need to check it out because it's very impressive. And so Palm Healthcare Foundation committed to $1 million over a span of 5 years. So we're definitely lucky and thankful to have that funding. I'm going to bring Lynn Hayes up. She's our chairperson of the Healthier Jupiter Initiative. Co-chair with you.
Yeah, I wanted to tell you a little bit about the community survey that we did. We've had a lot of thanks to our partner organizations, but they were really instrumental in getting this survey out, particularly to our target populations that these partner organizations serve. They sent it out to their staff, to their clients, to the residents, to their volunteers, and we felt very fortunate to get 376 responses back from people who are in the greater Jupiter community, and by that we mean people who live here, people who work here, or people who are learning here at FAU or one of the other schools. These organizational clients also helped us put the survey together. We had great input from Barbara Allen, who's on our steering committee, who represents SRA Research, and from our Palm Healthcare partners, who helped us not only design the survey, but also compile the results. Before we decided to do this, though, we looked at a lot of the data we already had in the community. The town of Jupiter does a resident survey every 2 years. Jupiter Medical Center does a community health survey. The Diabetes Coalition puts together risk assessment data. And we also looked at census data, and we got a lot of great information from that, and that helped us get our initiative started. But after the first year, we saw that we were missing some important pieces of information, and we really felt that we needed to do our own community survey. Now we had a better sense of what who our partners were, what the residents were interested in, and what the needs were in the community. So we decided to put together our own survey so that we'd have a baseline on certain data such that we could compare it to national norms in such things as, you know, what percentage of people do we have here who are obese or overweight compared to national norms. You know, as Todd pointed out, we're living in paradise here. We have every opportunity to get outside and be active. How do we compare? We also wanted to measure current levels of awareness in diabetes and also certain behaviors, and that information didn't show up on any of the other tools that we had. So we conducted our survey, and we have just started to compile the results. I'm not going to go into great detail here, but I do want to go through some of the highlights. It was interesting that the people who took the survey, the one risk factor that they were really sure about was that almost everyone knew some of the risks for diabetes. Few people knew all of the risks, but more than half knew that being overweight was a risk for diabetes. Not everybody, fewer than 2/3 of the people who took the survey realized that being African American or Hispanic put you at greater risk for diabetes. We had 17% who said that they'd been told they were either diabetic or pre-diabetic, and we're able to compare that to some national norms where we know in the US about 9% of the adults have diabetes and 28% of the adults have pre-diabetes, most of whom do not realize that they are pre-diabetic. So we have a little bit of a gap there that we can work on. Even though 53% said they recognized being overweight was a risk factor for diabetes, still almost 2/3, 64%, described their own weight as being a little high or too high. So they realized that they had some risks, even though they might not know all of the risks for diabetes. So we asked on the survey for people to report what their weight and height are, and we calculated from that a body mass index, or BMI, from that self-reported height and weight information. Because we knew, according to the CDC, that 71% of adults in the US are either obese or overweight, 71%. In Jupiter, from the self-reported height and weight measurements and our BMI calculations, we have 57% of our people here who are overweight or obese. And that's that could be a little low if they were fudging on their weight. Sometimes when you get self-reported weight, you think back to, when was I a weight that I want to report? And record that perhaps rather than what you might have seen on the scale recently. Still, that's more than half of our adult population here who have some work that they can be doing on that. And BMI is, it's not an exact measurement. I know that it does have some limitations. For example, most professional athletes who have a really high muscle mass can be on the overweight, in the overweight category, just because muscle weighs more than fat, and they may have a lot of that. But it's still the best measurement that we have on a simple basis, and it's what the CDC uses. So that'll become our baseline measurement that we'll be working towards. That's okay. We can go on to the next one. So we have considerable room for improvement when it comes to healthy behaviors. We have more than half who are trying to lose weight, but we have 39% who say they get no regular physical exercise. They either seldom go out and exercise or they may go out once a week. That's not enough. The Surgeon General says we need 30 minutes a day at a minimum of physical activity, sustained physical activity. And we're in a great place to be able to just walk outside and take advantage of the beautiful climate and the beautiful town that we live in and get that activity. We also know that even though people aren't as physically active as they should be, we have a majority of people, 63%, who say they want to be more physically active than they are. So we need to look at the reasons they've given us in the survey of why they're not more active and help people find ways to build more time into their day for physical activity. We also know that there's, in terms of eating habits, that only 36% said that they have fresh fruits and vegetables on a daily basis. And if you're familiar with the dietary requirements and recommendations, it should be half of your plate should be fruits and vegetables that you're eating on a regular basis. And fewer than a third are avoiding sugary drinks. I know, just on a personal note, it's been more than 10 years since I've had a school-age child in my house. But I was really shocked to hear when talking to teachers from an elementary school here in Jupiter, to hear that a number of elementary students come into school holding a designer cup of coffee to start their day off. And this is in a place, we're lucky enough to live in Palm Beach County, where the school district provides a free healthy breakfast in their Power Up for Breakfast program to any school-age child who wants it on a daily basis at school. So what's the disconnect here? Why do we have our elementary students coming in with a designer coffee that's no doubt loaded with sugar and probably lots of fats too? So those are the kinds of behaviors that we need to get in and address and get our parents and folks on board. So to conclude, we know that we've got some takeaways. We know we may be below the national average for being obese and overweight, but we've got a lot of room for improvement there, with over half of our adult population saying that they feel like they need to lose weight. We may be a little higher or a little lower than the national average for the people who have diagnosed diabetes, but we're certainly below the national averages for people who have prediabetes, and that's the group that we hope to reach with this preventive measures and the preventive message that we have with Healthier Jupiter. We found out through our survey that we have 16% of the population, adult population, who say they don't have health insurance of any kind. 16% here in Jupiter. So we're fortunate enough to have a resource in our community, My Clinic, that provides free primary care services and referral services to people who don't have health insurance. And we need to make sure that we're all working to, channel people to those resources that are available to them. And in particular, we need to help people lose weight and get to a healthy weight in a medically sound way, doing it the right way through increasing exercise and eating the right foods. So Carrie's going to come back up and fill us in on all of our specific plans.
And just to clarify too, that 16% too, how we asked that question was, do you have affordable health insurance that can allow you to go to a doctor? So with just a little caveat on that one too, we did ask that question, so someone may think maybe they have a high deductible. So with that question, we do want to think about that one. So Healthier Jupiter's plan, so we kind of talked about what our goals and our strategies are too. So this is kind of, we're moving into the next steps. And part of that next step that we include too are people like you sitting here too. So we want to make sure that you understand what Healthier Jupiter is, how you can get involved, and what resources you can provide to the community too, or just letting us know what would be good for you as a community member. And I'll let you read those. I won't read it out to you. So kind of specific planned measures. So we're out there doing at all of our health fairs and resources that we go to, we do those diabetes risk assessments. I have to tell you, it's been really eye-opening to people when they take that risk assessment is how surprised some of them are that they are at a greater risk for diabetes. So really just utilizing those, it's just a really quick diabetes questionnaire, so it's easy for people to do, and finding ways to get that out there more as well. So one thing that we have not talked about, but it really plays into Mayor Wodrowska too. He probably didn't even know this was coming, but it works out great how he, lined up everything. He may have missed one or two, but it's okay, because what the first project that we worked on, and we've been working on it for about 4 months, is what we're calling a Get Fit map. So with that too, it's really one of the things that we heard on our community survey was people don't say that they don't have facilities near them. Well, here we're so lucky in the town of Jupiter because there's pretty much a park that you stumble on if you just walk, 10 steps. So we created this Get Fit map, and we'll have it at the table as you leave too. So we'll have that resource so you can pick up as you go. But it's great too. And James is here. He is the designer of the map too. And he's a graphic designer, and anyone who needs anyone, fantastic. We had a kind of a vision, and we sat down with him, and we thought there's no way he'd get it. And the first time he blew us away with the design. So we're really proud that people can have a tool to get out there and know what the resources are in the community. So it shows all of the maps, and it also shows some of those breakdowns of if you wanted to go for a mile walk, if you wanted to go for a 3.1 mile. So it gives you those breakdowns of those. So we spent about 4 months on this map going through all of our subcommittees. So thank you so much to our steering committee, to James, to our physical fitness and marketing subcommittees that really worked on editing this to no end. So we even tried to make sure that we made it put some resources in Spanish as well. We couldn't fit everything because, those Spanish words, they're kind of long. I don't know what's up with that. So we put in as much as would make sense that maybe didn't translate very well. So we went ahead and put that resource already in Spanish as well, so we can utilize that wherever it can be used. And with our partners, important to include our partners. So this is the exciting part. So we are announcing today, so the first time in public, that we'll be sharing some mini grants with the community. So this is the first time we're doing this, so it's kind of a work in progress on our end. So with that, we do have a mini grant program announcement that you can pick up on your way out as you are picking it up with the map as well. So part of that is you'll see some of the requirements on there, and you'll see some of those on the mini grant program form too. But if you're a community member that has a great idea, and we've spoken to a lot of them that do, make sure to reach out to us too, because there's things that maybe we can do or work out or partner you with a nonprofit organization, or even some surprises that we'll have later on that are going to be open to community members. So it's important to follow us on social media and like our page. See where I'm going here? So with that, anyone who's interested in filling out for that mini grant would need to come to that October 26th grant workshop. So it is a requirement, just someone from your organization to attend that. And don't worry, it's not going to be boring and miserable. That's where we will have that national speaker of Mark Fenton coming, who's talking about bikeability. And he'll talk really inspirational as well, too. So we'll make it fun and inspirational and, an exciting time for you, too. And then, hopefully you'll get some money at the end of it. So with that, too, it is working out to $20,000 and about 8 grants of $2,500 a piece. And this is our first year, so we want to see what this looks like, how this works. So we're going to hold questions on the mini grant, and I know there's a lot of questions about it. And to be honest with you, we're still working out the details. So some of the questions we may not even to be able to answer for you at this point. But make sure Jean and Lynn are on our grants subcommittee, or myself, so you can speak to us at the end or reach out to us afterwards, and we can answer as many questions as we can. But the grant guidelines and all of the forms and documentation, all of the requirements will be on our website on September 30th. So there's definitely an opportunity to have all your questions answered. So this is exciting. What do you guys think? Do you think that's exciting? So one thing, too, is we really want to do, we have a lot of strategies and we have a lot of exciting things that we want to accomplish, but we really need you guys with those great ideas. I mean, some of the people that we've talked to in our focus groups and throughout our subcommittees, there's a lot of people that want to do good things that just need either a partnership or just a little bit of money or even just mental support to say, is this a good idea? Is this something that I should be doing? So we want to say, yes, it is, and go do it, and tell us what your measurable results are. So that's what we really want to get out there and do. So ways to get involved. So we talked about that El Sol Community Garden. Like us on Facebook. Invite Healthier Jupiter to speak at your organizations. And one thing is we really want to get the word out about this mini grant, so it's an opportunity that we want to really share with the community. So as many of you that have community organizations, neighborhood associations, anything like that would love to come out and speak. And also if there's any of you guys that enjoy public speaking too, on the back of that survey that you have too, there's an opportunity to say what you would like to do to help Healthier Jupiter. If you are, enjoy public speaking, go ahead and write that down there, because we'd love to task you guys with, a PowerPoint and just to go out there and give you all the tools you need to speak for Healthier Jupiter too. We'd love to do that. There's a Jupiter Walk and Bike event that's August 6th. It's in partnership with the town, so it's about bike safety. So make sure to look for on the town website. It's a tentative date of August 6th, but make sure to follow us on social media too, and we'll make sure to post that as soon as we get that up. Volunteer at our partner organizations. Edna, you'd always like a volunteer, right? All right. And then more events on our new website. So we're just launching our new website. We ran into a little snag, so don't go and look it up right now because it's not up there. But here's a picture of it. This is what it looks like. So within probably the end of this week, we should have it up and live. It's got a great calendar. It has local Jupiter healthy events as well. So if you do have an event in Jupiter that is a healthy event or just falls into that category, send me an email, go through our website, and we'll make sure to post that as well. We'd be happy to. One thing I'd love to have our steering committee stand right now and be recognized for all their volunteers and have worked tirelessly this whole time. So make sure to stand up. Dr. Fask, you need to stand. You're on that steering committee. And thank you guys for all that you do too. I definitely appreciate that.